everybody. My name is Heather Andrews, and I am here today with Greg. And Greg is going to tell us all about him and his business. So why don't you introduce yourself?
Okay, thanks for having me. My name is Greg Crawford, and my agency is the Crawford Health Group. Formerly a fitness professional, and then I sold that business and got into the insurance, health insurance, and life insurance business. And here I am, and I was able to connect with you, Heather, and happy to be here.
Awesome. So I'm very excited that you're here. I appreciate your time. So we want to tell everybody, what is your focus that you focus on? What is your ideal client that you're looking for?
Primarily two ideal clients. The first client that I work very closely with is young families. Folks with their health insurance, mostly self-employed folks that don't get health insurance the traditional way. So they need to buy their own health insurance, life insurance as well with young families. And then the other type of client that I work with are folks that are aging into Medicare and are going to be new to Medicare. So spend a lot of time with those folks. So between those two, they keep me pretty busy.
Understand completely. Now, with the different range of clients you have, do you work remote, home, office? How's all that work?
Good question, and all of the above. So I speak to people all over the country because I'm licensed in a lot of different states, but primarily in Florida. I do get a lot of folks in the, Sarasota, Manatee area. If you live close enough and you like to see someone in person and have that face-to-face, I do in-homes. I also meet, at different locations. My office is my home office. I have actually had a couple of clients come to my home as well. So it's whatever you're comfortable with. I also do a lot of phone appointments and then sometimes Zoom. A lot of people don't like to get on Zoom. So usually phone or in person.
That sounds great. Now, when you're shopping for them, I know carriers from our end, because we have over 150. Do you have one carrier or do you have multiple carriers?
So I'm a broker, so that means I am contracted with multiple carriers. So I am not married to one carrier. I specifically look for what's going to be the best fit for you. And I treat all my clients like they would be a family member to make sure you're in the right position with the right company. And there's a lot that goes into it with doctors, prescription drugs, things like that. But yeah, I have a lot of resources and different carriers that I can help you with.
Perfect. And with all these carriers, you're doing all the work, you're going through all the carriers, trying to find them health insurance. Now, is there a fee for you or does it just come from the carriers?
Yeah, it doesn't cost anything to work with me. I get paid directly from the insurance carrier. And in our industry on the health and Medicare side, it's a very level playing field. So it doesn't matter which insurance company I go with, the pay is the same. So I don't have skin in the game to lean towards one carrier or the other based on, my financial gain. So I work for the client, and I want them to be in the best position possible.
Absolutely. And then after you get them their life insurance or health insurance, then you stay with them. How's that work after the fact?
Yeah. So, after we get the policy activated and I get my clients situated, I make sure they have everything they need. I'm still there ongoing. I'm still the agent of record. So what that means is you're technically still on my book of business, but I'm still available. There's things that happen throughout the year, changes that happen. We have open enrollment every year where you can make those changes. It's July right now, and I'm getting prepared for our new open enrollment coming up in October starts Medicare, and then November starts under 65. And I have a lot of appointments with ongoing clients that we meet. We make sure I educate them on what changes are happening. If they're in a good spot and they're happy with what they have, then we just continue it for the following year. But if they want to make changes, then I could help facilitate that as well.
Perfect. Well, it seems like you have this system down, which is awesome. Is there anything else that you'd like everyone to know about how you can help them out?
Yeah, I mean, I just take a holistic look at everything, everything from your health, your finances, because you really have to do that. So everyone is different. So we tailor the plans based on your specific situation. I'm very happy to be teamed up with you, Heather, because I stay in my lane, which is strictly health insurance and life insurance. And now I have a resource with you, because I have a lot of clients that are coming to me first and then need, your type of service. So, so I'm studying what's going on in the health, Medicare, and life insurance field all the time. So I'm keeping my clients up to date.
Awesome. Now, if someone wanted to reach out to you, what's the best? Email, phone number, website? Can you give us your contact information? We'll also put it below, guys, too.
Yep. So you can email me, greg@gregcrawfordinc.com. You could also call me. It's 941-347-0199. That will go directly to me. I answer the phone so far. That could change, but right now you're going to be talking to me. And then you could also text that number too. I do receive a text message to that number as well.
Perfect. Well, if you guys have any questions, please reach out to Greg. He'd be happy to answer anything that you have and get you helped out for this year. And I really appreciate your time being here with us. And we'll put all the information below. And if you have any questions, please just reach out. So thank you so much. And we will talk to you guys all soon. Thank you.
Thanks, Heather.